Let's get started. Good morning, everyone, and welcome to the Dallas Chamber of Community Affairs. Today, our guest is Jayme Thompson. She's the Operations Executive Administrator for the Adventist Health Columbia Gorge, and I know that title carries so much more than just a few words. So she has agreed to come today, and we would love to welcome her and give us some updates. So before we do that, you may know most of the people on the screen, but I give them an opportunity to introduce themselves and what organization they represent. And then as if they promise to keep it short, they can give us a little update so that you're familiar with the people here. This is also being recorded and it will be uploaded to our YouTube later. So for viewing later on that. So I'm going to start with the person who doesn't know how to retire, Scott McKay.
Good morning, everyone. Good morning, Lisa. Good morning, Jayme. Scott McKay, community liaison for Circles of Care, and that Circles of Care connects older adults with volunteers. And the challenge we always have is finding enough volunteers. The second thing is that we are applying for a grant for a respite program for 4 hours a day, once a week. And we have to have that in tomorrow. And I think we're getting it all wrapped together. We'll be talking with Rob Garrett, whose board agreed to submit the grant. So we're really excited about that. And so we put a lot of effort into the grant preparation, and I think in the middle or end of May, we'll find out whether we receive the grant. So that's pretty exciting, and we're just keeping our fingers crossed. And then we're just getting ready for a booth at the Cherry Festival, which I've been telling everybody I know out of town to come and visit. So I'm looking forward to that. Thank you, Lisa.
Thank you. And yes, you're going to get your letter this morning, I promise. I've just been a little occupied.
Now, Lisa, I'm not, I know I'll push you because I know you seem to have a few things on your plate. So,
some cherries. So anyway, Phil Brady.
Good morning, Phil Brady. Good to be here. Don't have enough and don't have a lot going on today. I'm actually have a surprise-free morning, so I'm going to go work in the garden. Last night was at the firemen's confab on Juniper Flat. That's all the fire chiefs were getting together, organizing themselves, looking forward, getting ready for this season. It looks like they've got their crews well staffed. A couple losses from the National Forest, but the local fire departments are well staffed and ready to go.
Great, thank you. Well, if you're really bored, you can come down to the grounds where the Cherry Festival is.
I am surprised to see you with looking so complete or some composed this morning. I would be going crazy.
Coffee and puppy hugs. They'll do it every time. So, Vesta Smith.
Good morning. I don't represent anyone except myself. I just like to keep up with the community. And however, I do coordinate the gift shop at the hospital. So y'all come up and shop. We've got some great items.
Thank you. Dan Spots.
Thank you, Lisa. Dan Spots, outgoing economic development officer with City of the Dalles. I actually retired at the end of last month. Been hanging on to train my successor, and I will announce and we're kind of just rolling this out unofficially, but it is official. Jacob Anderson is a former Klickitat County Commissioner, been around all his life, and I've been bringing him up to speed on all things related to urban renewal and the EPA Brownfield program, Enterprise Zone, other things going on around the city. So hope to be bringing Jacob on one of these meetings before too long. Thank you.
Thank you. And do we have somebody on iPad 1278? And no worries if you don't have that ability. If you would like to introduce yourself, go ahead and write in the chat box. We would love to know and be able to greet you. So with that, I'm going to turn it over to Jennifer and Jayme and take it away. And just thank you again. I know this is early in the morning, but thank you for being here. And I'm just going to let you take over. I'll watch for questions and stuff so that we make sure, whether it's in the chat or in person, we get those asked.
Well,
Right.
I'm Jennifer Zimmerly, Marketing and Communications Manager here at Adventist Health Columbia Gorge. And like everybody else, I'm full Cherry Fest mode. As you guys have heard the last couple of weeks, we're super excited to have a very large community booth with One Community Health and OHS Unite Cancer Center coming together in partnership, which Jayme's going to talk about in her presentation, in order to help care for our gorge. And we also will have a float, so y'all come out and say hi. We're looking forward to it. And with that, I'm going to share my screen and my presentation here for Jayme. And it's in theory if it, actually wants to share. Oh, there we go. Beautiful. And
There it is.
there it is. And I'll let Jayme take over and tell her all the great things that are going on. Thanks.
Thank
Thank you, Jennifer. I was going to say, Lisa, 7 a.m. isn't so early for me. I'm usually here at work.
That's a
Or-
good thing to know because I'm here usually way before 7 too. Now I know who to go have coffee with.
Yeah, there you go. There you
All
go.
right.
All right. Well, Jayme Thompson, Administrator, Chief Operations Officer here at Adventist Health Columbia Gorge. I wanted to introduce myself and give you guys a little backstory of who I am and where I come from. And then we will review some really exciting strategic updates and where we're going, new initiatives for the hospital and healthcare community here in the Columbia Gorge. So I was born and raised in Sherman County on a wheat farm. My dad, Gary Thompson, was a wheat farmer originally, but then quickly got into leadership. He was a county commissioner and later on the county judge for Sherman County. My father was very passionate about always doing the right thing, leading by example, and very engaged with the community and with the system of county commissioners and county judges throughout the state of Oregon. So he's my role model in leadership. Unfortunately, he passed away several years ago, but he is always my guiding light in remembering the why of why I do leadership and the things I do. So from Sherman County, I moved to Southern Oregon University and actually got my bachelor's of nursing through OHSU down at Southern and moved to Portland. Was there for several years as the cardiac ICU nurse. And quickly learned a lot of great things at Providence St. Vincent's, but quickly realized Portland was not my home. So moved back to Sherman County where I wanted to be with my family, raise my children, and have a life. So I've been here at MCMC and Adventist Health Columbia Gorge for 24 years. I started in the ICU on night shift as a nurse and worked my way down into the emergency department. And then at the ripe old age of 26, was asked to step into a director of emergency department role. I look back now and I knew nothing about leadership. So it was really an eye-opener for me. I did that for a few years and then had twin boys and quickly realized I could not be a director and have brand new twin babies. So stepped back into staff. And we've done various leadership roles and staff roles here at the hospital for the last 24 years. Most recently was the chief nursing officer here. And then in November was blessed to be awarded the position of administrator and chief operations officer. So I have a long-standing history here. I truly understand the boots on the ground healthcare component in the hospital setting. I've done pretty much every role in nursing within this organization. So I have a really strong grasp on operations and the why we do things. I think that set me up for success and success in this role and really building that culture of understanding because I've been in their shoes. So very fortunate to be in this role and leading this amazing organization. So that's a little bit about me. So we'll move into our strategic plan. We do a strategic plan every 3 years. Our strategic plan was a little different this last time because we really engaged our leaders, our staff, our physicians, providers in creating the overall strategic plan for the organization. So this is all of our voices. This is not a top-down approach. This is all of our voices coming together to create that foundation, that pathway, that North Star of where we're going as an organization. And I feel very proud of that. I feel very fortunate to be helped leading that, but it's so nice to see something come together from all of us. So our 4 pillars are sustainable growth, a culture of excellence, strong workforce, and enhanced community. And all these things come together nicely and really propel us forward in strengthening our mission. Okay,
Jayme?
yes.
So I'm very happy to be here on this call with you. As you know, my history was ended about the time you were moving to Adventist Health. When you made this strategic plan, the we, is that the local staff and up, or the local staff and up with some participation from Adventist or corporate?
This is all local. This is local voices. The system does provide some guidance on our mission and values, which align nicely with the Plaintree mission and values. But really, this is all our local voices into this plan. Good question. All right, where we are with financial and operational efficiency, one of our pillars. It's a tough one to get to and to really succeed in the healthcare climate. As many of you know, hospitals throughout the nation are really struggling. The increase in operational costs, coupled with the reduction in reimbursement, has crippled some organizations. We need to stand on our own 2 feet as a local market. We do have system support with the dollars for capital, but they're not expecting us to lean on them for financial sustainability. So really, we need to create structure and really strong initiatives to get us financially sustainable. Some of the things we're doing is primary and specialty care clinics have increased their capacity, changed their templates and their timing of appointments to really open access for our community. We're fully staffed in primary care. We're pretty good on specialty. We have some areas like OB and orthopedics that we need to really work on getting some providers on board. But we're doing amazingly well given where we were 5 years ago. Fully staffed, open for appointments in primary care. I say this to all the community events that I go to. I think it's really important to get that word out there. In the emergency department, we have a new medical leader, Dr. Baker. If you haven't met him, he is an amazing individual, truly cares about this community, and then just doing some really new and exciting things in the emergency department. The other exciting thing is our contract roles. So during COVID, a lot of hospitals had to hire temporary nurses, travel nurses to come in and take positions. We've been successful in transitioning 12 nursing contracts into permanent positions here because they love the culture and this organization. They've agreed to join our team. We're very excited about that. And working towards reducing locums. Locums are expensive, first of all, and secondly, they're not truly ingrained in our culture and our community. So really working hard on taking a look at those locum providers and how we can either cut costs with locums and increase recruitment to get those permanent providers here. As Jen mentioned, OHSU Night Cancer Center, very exciting. In February-ish, we joined a long-term agreement, a collaboration agreement with Night Cancer Institute. This provides the support and the backbone for a small community cancer center to have the resources and the support from a large academic medical center. It creates the networking, the relationships, that providers can reach out and understand the best practice and where cancer care is going and have that resource. We're very excited. We've started the collaboration meetings once a month. I'm very excited to be moving forward with NIGHT. There's going to be some new signage and lots of advertising going out about this partnership, so stay tuned for that. Medical and radiation oncology, also have heard through the grapevine and throughout communities, not locally, but outside of our local area, that we've been closed, and that is not true. Our medical and radiation oncology is open 5 days a week, and we are accepting new patients. So very excited about that. We have an amazing, engaged radiation oncology provider, Dr. Winnie Wong. Also just like Dr. Baker, an amazing leader, very engaged and wanting to propel Cancer Center forward for this community. And she's just, I cannot say enough good things about her. She's fantastic. And then lastly, exciting news. We did get a letter from ODOT deeming us mountainous terrain, which allowed us to apply for the critical access hospital designation. And that application has officially been submitted. This is one of many strategies that we need to do in order to meet the margins. Meeting the margins means that we can reinvest in our people, reinvest in capital, and reinvest in the community. So very excited. We should know within the next 30 to 90 days if that application has been approved, and we will move forward. It's a long process. It's about 6 months to a year to get the designation, but very excited to get that moving forward. Any questions on it?
Yes, Jayme, I'm going to probably have lots of questions. This is so good. All of the things you're talking about there are great, transferring roles from locums up. Especially congratulations for finding somebody for the radiation therapy. Has Dr. Stelzer really retired, or is he sticking on?
He isn't officially retired. He is staying casual for us. So he's filling Dr. Wong is on vacation or needing some days off.
Yeah, so he's fishing. Stelzer's probably fishing more.
Yeah.
And the last one is a huge accomplishment. That was talked about going back at least 10 years to try and get critical access designation, because it makes a huge difference in the repayments. Going back to OSU Night Cancer, is that a relationship just with Night Cancer, or there's the OHSU relationship through Adventist Portland? So how are these separate agreements?
Yeah, they're separate agreements, and it is just with Night Cancer Center.
Yeah.
Yeah.
Dan, Spots, you have a question?
Thank you, Lisa. Thank you, Jayme. This is all wonderful, wonderful news. Recognizing the importance of that critical access designation, is there anything that community partners can be doing to assist, or should we kind of stay out of the way and wait for the process to unfold?
Thank you. I appreciate that question. I think right now we're all learning what we need. And critical access is new to us. Thankfully, we onboarded Wendy Applin, retired, and we onboarded Micah Smith. He's our new finance officer from Tillamook, which is a critical access hospital. So he's been our source of truth and helping guide us moving forward. I do not think community partners need to assist right now, but I will definitely reach out if I need assistance and once we learn more. Thank you for that. Okay, we'll move on to the next one. Quality, safety, patient experience, the why of what we do, right? We have a leadership team here and an executive leadership team here that are truly focused on doing the right thing and keeping the community and the patients at our core focus of improvements and our core focus of decision making. So I'm very excited about our leadership team and the executive team. We're all really grounded in that, and it is a different culture and a different feel than the past. So Quality and safety is top of mind always for us, and I as a nurse understand this very deeply. Some of the things we're doing is we've got access to tools now that we're a part of Adventist Health. We've got access to tools that allow us to round on patients and gather information from them. We're doing a lot more reporting. We have daily safety huddles every single day that allows leaders and staff to be able to elevate those safety concerns quickly. We've seen really good resolution and quick turnaround of solutions to those safety issues. Patient whiteboards in the rooms. If you've ever been up here in the last several months, we've got these new fabulous whiteboards that capture real-time feedback and allow the patients to stay up to date on what's happening with their care. The CHIP and the CHAW, the Community Health Assessment and Community Health Plan, very important to us, also helps drive some of our initiatives and our strategic plan here. So we're working with our partners on those assessments and those solutions. The Plane Tree Steering Committee is starting a person-centered staff training, really refocusing us on the Plane Tree experience, right? That's where we all started. So refocusing us back on the Plane Tree experience and strengthening that between our staff, our leaders, and our patients. And then, of course, which I love, the PFAC, the Patient Family Advisory Council. This is our community, our patients coming to us and giving us feedback that help drive our decision making. We've recently had the more we talk about it, the more leaders go to the PFAC, bring their ideas, bring their initiatives, and gather that feedback from our community and our patients to help us drive the right decisions for our community. So very excited about our PFAC committee and all the good things that are coming out of PFAC. So any questions? Scott?
There you go.
Jayme, regarding that patient-centered care, I'm involved with the Dementia Friendly Wasco County Initiative Partnership, and the Dementia Friendly America has a suggestions for dementia-friendly hospitals. And when I look through it, it really seems to me the key is patient-centered, healthcare, and whether in the patient-centered staff training, just something talking about dealing how to work with those who may come in with and have dementia, living with dementia, since about a little bit over 10% of those 65 and older have dementia within Wasco County. So just a thought about something to include in the person-centered staff training.
Great, thank you for that feedback. Any other questions before I move on? Oh, Michelle, good morning.
Okay.
Good morning. Dan let me know you were on, so I had to join. Thanks. For those of you who don't know me, I'm Michelle Spots, Dan's wife, and I serve on the AHCG Community Board. I'm also on the Plane Tree Steering Committee and the Patient and Family Advisory Council. So one thing I wanted to mention, and Jennifer, you know this, but one of the things we've talked about is starting up a lunch and learn session for staff. And our first speaker that we're planning to have is going to be talking on dementia care.
Fantastic. Thank you, Michelle. Okay. Our third item, retain, recruit, and engage. Now that we're past COVID, the times of COVID, we lost providers, we lost nursing, we lost support staff. So re-engaging, refocusing on retaining and recruiting our staff and engaging them. Engaged culture or an engaged culture creates that retention that we need. So very happy that our providers and staff are actively engaging in the recruitment process. They're part of the interview panels. They just recently we had to pass on 2 providers because of during the interview their behavior and how they treated the staff. And so we are creating this culture of setting the behavior expectations at the forefront and saying no to providers or staff that don't meet those behavior expectations. So having them actively involved and engaged really allows them to help drive our decision making on recruitment and also the hiring of our new employees. Lots of campaigns going on, and lots of movement on wages, and having the access to market data through our system's been fantastic. We're able to adjust wages as needed, and then getting candidate feedback to help us improve future recruitment is really important. We have, like I said, a new leadership team, totally different culture and different style of leadership. Very excited. We're all engaged in creating that culture of trust, the safety culture, and a culture of retention here locally. And we're making, I believe we're like the lowest turnover throughout the entire Adventist health system overall. One of the lowest, and then the top 2 for nursing, reduction in nursing turnover. So we've done some really great things here. And then the Every Encounter Counts Awards. This is really taking the time to recognize the small stuff and sometimes the big stuff of staff excellence. PFAC's involved, lots of team reflections, and we also are starting to do stay interviews, really listening to our people and understanding the why of why they stay, and really focusing throughout the organization on that culture. 0 nursing turnover for 4 consecutive months. That's a huge stride in this, in the culture of, or not the culture, the landscape of healthcare right now. So that's very exciting. The EEC Awards, I will say, we just did one yesterday down at our sleep center. It's so special. The leadership team gets together, reads the story, and truly takes, 10 minutes to recognize the amazing work that our staff do on a daily basis. And we need to share those successes and those stories throughout the organization and with our community. It's so important to share the good and the why we are here. Any questions on recruiting, retaining, and engaging before I move forward?
I do have one, and I suspect the challenges will be the same, but in talking with other industries, the issues of affordable housing and childcare, you have great and small, so you have an excellent tool in your toolkit there.
Yes.
What about housing?
Housing is an issue. Housing is an issue. We have a handful of staff that haven't been able to find affordable housing, and so they're living in their camp trailers at various locations. Yeah, it's a concern. And a lot of our staff have obviously gone east. It's a little more affordable in Goldendale, Sherman County area, but the number of houses available in those areas is very small. So housing is a concern for our organization. A lot of our providers live in Hood River. Of course, they have the salary range that allows them to live in Hood River. It's our frontline staff, our support staff, that I'm more concerned about on the affordable housing side of things here. And being landlocked and not having those options for our staff has been difficult.
Jayme?
So, yeah.
So down at the Housing Authority, it's a new moment there. Karen Long has taken over, and we've just hired, I have not met this person yet, a director of real estate and development. And that person's job is going to be full-time developing housing. So the housing authority has two arms to it. One does the vouchers and Section 8 housing, and Karen Long continues. That's her expertise. But then, because this is a need, we want to develop it. And since it's a new moment, we could reach out and see what we could do together.
That would be fantastic.
On that point, Phil, you would have been encouraging us to reach out to Karen. We've had one meeting, one or two, but we need to continue that dialogue with the city.
Okay.
As we look at land trust models and other things that where the city can help participate in that as well.
And once again, Karen's expertise is in the voucher side of it. And so as we move forward, the new person whom I haven't met, but we have signed, that would be the person to contact for developing new.
Okay. Thank you. All right. My soapbox, communication and collaboration. I feel very strongly about community engagement, developing relationships with our community partners, both in healthcare and outside of healthcare. I feel like this organization has struggled for a very long time in not being a part of the community. So I talked about this a lot through my interview process, and I talk about it a lot every single leadership meeting. It is really important that we engage and build those relationships between our community partners and our healthcare community. We can't be all things to all people. We need to build those relationships to figure out how we can collaborate and not always compete. Healthcare cannot survive in this community and throughout the gorge if we're constantly competing with each other. So outreaching and having conversations with Providence, Hood River, Skyline, KVH, One Community Health, various entities throughout the Dalles proper, and figuring out how we can develop a healthier healthcare community in the gorge as a team and not as individuals. So I feel very strongly about that, and Jen knows. And we have been making our rounds and having conversations with healthcare partners throughout Columbia Gorge, and then also east of us, and south of us, and north of us, and reaching out to those small rural health clinics and various hospitals to the east of us on how we can support each other, share resources, share information, to really drive healthcare forward, and for all of us to be sustainable for the Columbia Gorge. It's very important. Other things. Oh, is there a question?
Yeah, Scott has his hand up, or he left it up. I'm not sure.
I got a question. Well,
Okay.
not really a question, but just a comment though. It's amazing how everything's always circle around, because it really sounds like to me Mark Scott back in his days when he was the president and CEO of MCMC, and he worked on trying to develop partnerships with the other hospitals and how to save money and then being able to split that money among the different hospitals. But also, I remember when I was involved with Special Olympics, they had a program where all the employees, they would submit the number of volunteer hours they contributed to a community nonprofit, and then the hospital had some level of funds that they then distributed to those nonprofits based on the involvement of their employees. And that was always a nice way to raise money for your program, but also acknowledge all the support the MCMC or Adventist employees contribute to the community. So just it all comes around. Thank you.
Thank you.
And Phil, you have a question?
Yeah, with regard to community involvement, you not to say how long ago might remember this, that there was a time when MCMC was accused of having its tentacles in every aspect of community government, and that is no longer the case. But uh, the staff and workers, and I'm thinking also the mid-level staff and especially nurses are very capable people and could be useful in filling lots of roles and boards in our community. So if that is encouraged, that would be welcomed, and happy
Yeah,
to help.
that was one of my asks of it, first the executive team, that we all join a board, a community board or a council, just so we
Mhm.
can have a voice and be a part of the community. So I sit on the CCO board. I'm also part of the Sherman County Medical Clinic board. And various people are joining various boards, and it's not to take over, but just to be a part of the community, really. It's just to be able to build those relationships and share, information back and forth across the aisle. I think it's really important for us to do
Let,
that.
let me plant this idea then, just as you grew up in administration and leadership within Adventist Health, it's good for communities to have younger, middle-aged folks start working on boards and then grow up into leadership roles. So if we can look past your executive team and give nudges and prods to people at different levels. And once again, I go back to nurses. They are very good at coping, and that's what a lot of boardsmanship takes.
Yeah, yeah. Thank you, Phil. Okay, so maintaining our Google star rating, this is kind of new to us as well. We never really tracked Google star rating, but this is community perception of our hospital, right? This is really how our community feels about that, about us and the things we do. Part of the community perception is obviously us getting out there and actively participating in those community boards. And to Phil's point, starting at the executive team, but then driving those community boards, memberships down to our leaders and the staff level. I agree. It is really important that it's a great growing tool, but also a great way to get your staff engaged and part of something. I spoke about our engagement with the outreach events, with our healthcare partners and partners here in the Columbia Gorge. But we're also, parades, fairs, recruitment events. We're out there and being a part of the community. I feel very strongly about the parades and the fairs as well, right? We're serving not just Wasco County, but Sherman and Gillum and Klickitat County as well. So being a part of those community events, not just the Dallas proper events, is really important to all of us here. And so Jen has been very great at getting out there and helping facilitate those events. But the more we can be visible and support those communities, the more collaboration and relationships will go. Any questions about communication or all of it? I'll just say I really appreciate you having me on today this morning. I've spoken to various community groups, and it's really important for me to share who I am and why I'm here, but also what we're doing here in the organization to improve the care for our community and improve healthcare throughout the gorge. So
Awesome. Thank you. I see a couple more hands up. Phil Brady, we'll let you go first.
Thank you very, very much. I'm so glad to know more about you. I think it makes a difference in our community that you are from Sherman County. That makes we understand what that means. A long range plan, and the long range keeps getting pushed further in the distance, is the hope and plans for a new hospital. I know very well what the financial situation of all health systems doesn't, and the cost of building everything looks prohibitive now, but we shouldn't let go of that dream. From the county side, I'm still working to keep space available on Kramer Field. There are, it's one of there are pieces to the puzzles. One thing moves and another thing moves. But we are working on getting those plans ahead. But we're talking out in the future, but keep that conversation happening with Adventist Health, because that would be a huge transformation for our community. It'd be excellent for the health system, and it can happen.
Yeah, yeah, and all these, the slide I went over with financial sustainability, those are all the things that'll get us there. I mean, the critical access and making some decisions on core commitments to our community and reducing, the locum cost. Those are all really important pieces to the puzzle to get us to reinvest. And yes, long-term goal we would love to build a new hospital.
Dan, you have a question.
I'm hoping I keep signal here. Can everybody hear me still?
Yeah, we can.
The signal got shaky there for a second. Couple of points also on long range. Please keep in mind childcare. We've had some good news, of course, with an EPA grant, 20 million. The bad news is it's frozen, and when we're uncertain of the future on that one, along with many other EPA grants across the country. But coming up fairly soon is an economic opportunities analysis through the city of the Dalles. I'll be serving on that committee and want to keep healthcare front and center as we engage in that discussion. I'm curious as to whether, for instance, Columbia Gorge Community College had usually had an economic impact, community-wide economic impact analysis done. Are you aware of anything like that through Adventist, the impact of your workforce as a contributor to the community's economy, things of that nature? Those are data I'd like to bring forward.
No, but that's a great question. I will. I wonder if some of that work was done. I don't remember, but I wonder if some of that work was done when we were looking for a partner. I don't know, Michelle, because you were a part of the board, if you remember any discussion of workforce analysis or economic analysis on.
I don't recall that information, Jayme. We do have the community, the 501c3 thing. What is it? The community contribution that the hospital makes.
Yeah.
So that might be one thing to look at, but I think what you want to know is, like how many employees we have, what is the overall economic contribution of having staff here? Because I think we are still the largest employer, right?
Yes.
Yeah.
And we tend to take that for granted. The hospital is doing a fantastic job of surviving in these uncertain times. But the profile community-wide, well, we think of the cherry industry, we refer to the old aluminum industry, no longer there. But let's not forget this major employer here in the community, and keep that on the radar.
Yeah, I appreciate that. Yeah, we've been the largest employer for as long as I've been here. So
yep.
Yeah.
I think it bounces between in situ and Adventist Health, depending on what in situ staff is, both about 2,000.
Are they in the Dalles though? They're not.
No.
Yeah.
But if we consider it as a region.
Yeah.
Good.
Yeah. But I'm also thinking of what you talked about, Jayme, in terms of healthcare in the Dalles. Of course, it's AHCG, but it's also the One Community Health and Mid-Columbia Center for Living and all the other service providers. So
it's that sector, that healthcare sector entirely. Yeah.
It's a pretty big sector.
Yeah, it is. It is a pretty big sector.
You have a question?
Okay, I may have missed this, Jayme, but Are there still discussions about redesigning the emergency room space that
Yes.
I've heard about?
Mhm.
And what are the plans or considerations or challenges?
So we did a scoping of what it would look like just to facelift. I call it a facelift in the emergency department. Keep the current space, but redo the floors, change some operational pieces of it. So we got that information back from our system. And the other ask is what it would look like if we were to add on to that space. So add an additional 8 rooms to the west of the hospital here. So I'm waiting for the Office of Design and Construction, which is a system resource, to provide that quote so we can have an idea of what it's going to look like. The facelift, because of the flooring project, was close to $3.5 million, which was a lot. So we're taking a look and analyzing, do we do the facelift or do we just wait and move forward with the addition to the emergency department. So yes, it's still top of mind. It's one of many projects we're working through.
Mhm.
Question about the clinic in Hood River down by the landing. Is that as steady as it goes, or are there thoughts about doing things differently there?
One of our strategies is taking a look at our leased space. We pay a lot of money in leases. So currently evaluating our presence in Hood River and what that means to the community. We have currently, there is urology and orthopedics, limited days of the week down there. So we're taking a look at like what that looks like and if we truly need to have that Hood River presence, or do we develop, relationships with Providence Hood River to collaborate on things versus have a presence in physical location of Hood River.
Yep.
Yeah.
That's great.
Yeah.
I don't see any more raised hands at the moment. You guys are great with questions though. And it is about 7:53. So Jayme, is there anything that you would like to wrap up or leave final comments?
I would just ask you guys reach out if you think of something the hospital in this market needs to be a part of in the Dallas community. Do not be afraid to just send me an email, and I'm happy to be a part of whatever committee or discussion is needed. And we want to be involved and help this community. And feel very passionate about that. So I appreciate the opportunity to speak to you guys. Very blessed to be in this role and leading these amazing teams, our amazing employees. Very committed to this organization. So thank you for this opportunity. I appreciate it.
Thank you. Jayme, or Jennifer, would one of you want to pop your full contact information into the chat so that people can grab that?
Yeah.
That would be great.
And Jayme, I just want to thank you for the amazing job that you're doing. I'm just so thrilled to have your leadership. So thanks.
Thank you, Michelle.
Well, as someone from the hospital, I would like to say that I think Jayme is doing an excellent job. She's always listening and she's always willing to see what can happen to make our hospital the best. Thank you, Jayme.
Thank you, Vesta.
Jayme, for my part, your dad was a friend and he would be proud.
Perfect. Thank you. And thank you for your participation this weekend. We have reserved a very long space for you because we know there's a special item coming down to be at the community fair during the Cherry Festival. So we do appreciate not only that, but also your support as a sponsor for our outdoor vendor market. It takes every sponsor to make this event happen, so we appreciate that support. And so with that, I'm going to let you all go. If you have any questions or wondering what's happening, go to northwestcherryfestival.com. That will get you to the full itinerary, and there will be more than you can choose. So we'll do that. And everybody have a really good weekend, and thank you.
Thank you.
Thanks, everybody. Bye.
Thank you.